welcome to the Digital Mental Health Musings podcast series to all of those listening, and also to our guest today, who is Jay Court from This Way Up, where she's working as Digital Mental Health Engagement Lead. Before I introduce a little bit more about Jay, I just want to say I think today's podcast is one that you will absolutely enjoy. So for those who've been following our Musings podcast, you'll know we cover a whole range of digital mental health related topics, including a spotlight on specific online CBT programs. So this week we have the pleasure of Jay joining us for a conversation about the This Way Up program, or suite of courses, which many of you may well have come across or used in your practice, but also she previously worked as a mental health nurse in acute care. So Jay brings a really unique perspective to our podcast series with her background as a mental health nurse and now subsequently in her key role as engagement lead at This Way Up. So welcome, Jay. Thank you so much for joining us.
Great to be here. Thanks for the invite.
So I guess a nice starting point would be, before we talk about the This Way Up suite of courses, can you tell us a little bit about your journey from being a mental health nurse, and I think stuff during the COVID pandemic, I read as well, working in acute care, to being in the role that you're in now at the This Way Up?
Yes, I'd love to. Thank you. So yes, I did come to nursing as a mature age student. My previous background was in documentary producing. So I had a career in that area, and it was kind of living in Africa for a couple of years and traveling around. I got really inspired and decided that health communication was something I was very interested in. And I suppose it was the health stories that I kept reporting on, particularly maternal health was a big passion project of mine living in Africa at the time. And I decided to go to nursing school with the view of potentially becoming a midwife. But when I completed my master's, well, as I was completing my master's in nursing, it was on my mental health placements that I realised there were so many transferable skills from my background in communications. And it turns out, I learnt on the job that mental health nursing is very much about communication. And so I just found my feet there. I loved it, and I decided that was going to be where I pursue my graduate year. And like you said, I finished my studies at the end of 2019, so I became a new graduate nurse in February 2020, which was a very interesting time in the world.
Absolutely.
So I was starting my graduate program as a global pandemic was unfolding.
Of course you were.
They talk about transition shock of graduate nurses, but I think our cohort had something else entirely. There was a lot going on. I had friends, re-diverted to COVID wards and all the rest of it on their first week of being a nurse. So it's been a big journey. So then I found myself in my graduate program of mental health nursing, and in that time I did 3 rotations. So I was in, as you said, an acute inpatient setting. I was in the community mental health team, the acute care team there, and I also spent some time in a high dependency unit, inpatient high dependency unit.
Yep.
And this job popped up as digital mental health engagement lead, and I thought, what does that mean? I just didn't even know what it meant. And if I'm being really honest, I didn't know the difference between telehealth and digital mental health. I've learned a lot about telehealth in my studies, but when it came down to it, when I actually started to look into This Way Up, there was a lot of learning that I had to do about that, just the idea that treatment is available online. I think we assume that people know this, and I think it's really good to remember, and I try to include it when I'm talking to people, is that digital mental health is not telehealth.
Yeah. But can I just jump in a second?
Yeah.
Okay, so had you been exposed or come across digital mental health in either during your nursing masters or when working in community or ACT?
I had never been exposed to digital mental health treatments in my studies or in my, just a few weeks before I left my old role, I remember the psychiatry registrar in the acute care team brought up in a multidisciplinary meeting, oh, why don't we consider this digital mental health service this way up for this client? And that was the first time that I'd heard anyone mention it, actually. Yeah.
Wow, that's interesting timing, isn't it?
Yeah, it was interesting timing. But I guess something I took away from my time particularly in community mental health was just the barriers to care. We know all the barriers to appropriate and timely mental health care, but I think working in that kind of busy environment where resources are scarce and people are in need, and there are still people in the community whose needs are not being met. And I found that really difficult to sit with working in community mental health. And, we would speak to people on the phone at night, for instance, or do home visits. And you really see the lack of services available to people after hours. And so that's where I see This Way Up being and other digital mental health services being a really good offering to throw into the mix, because your specialist is not available 24/7, not available Saturday morning, Sunday night, Thursday 3 a.m. But you can jump online and work away at some skills. You can get some treatment online, and I think that's a really big message that is still not widely understood.
Yep.
That even when you go to some online directories, it's clear that there are mental health resources online, but I don't think the message that the treatments are also available is widely understood, in my opinion.
Yeah. So how does that fit, Jay, with your sort of current role as engagement lead at This Way Up?
Yeah, so I think it's with my nursing background, it was definitely an intentional move from the team here to hire somebody with a mental health background, a mental health nursing background.
Yeah.
And we definitely are looking at ways of broadening our content out to be more relevant to people from a range of health professions. Yeah. And that includes allied health, OTs, physios. We've got a strong base with GPs and psychologists and specialists, yeah. But increasingly there's a number of different other health professionals using our services, including counsellors, phone counsellors, for instance. And so, a lot of my role has been about that relationship building, finding out what the needs are from our stakeholders, from the colleges, developing resources, drawing on my old career to create video resources, particularly for clinicians, to support them with that choice to integrate digital mental health tools into routine care.
Yeah, that's really interesting hearing your sort of career pathway, if you like, and how it's all sort of merging together with combined skill sets, which is fascinating to hear. Could you give us, for those people who may be listening who maybe aren't too sure about This Way Up, or they've heard of it but don't know what it is, can you give us a bit of background about This Way Up and sort of what it seeks to achieve in the Australian healthcare system?
Yes, good question. So This Way Up comes from the Clinical Research Unit for Anxiety and Depression. We're a joint initiative from St Vincent's Hospital in Sydney and the University of New South Wales. CRUfAD has been around since the 60s. And we have a tertiary referral anxiety disorders clinic, which is a face-to-face and telehealth clinic. And we also have the virtual clinic where we run our randomized controlled trials, of which we've done over 30. And it was really from that clinical research expertise that This Way Up was born over 10 years ago. And it's based on the principles of cognitive behavior therapy. So it's been digitized. So we're using internet-based cognitive behavior therapy. We now have 18 programs, disorder-specific programs, wellbeing programs to offer.
Wow, 18.
Yes.
And they're all CBT based.
Or even the wellbeing programs all use CBT principles. They're shorter than the other courses. Yeah. But and we have a lot of coping tools, resources, and we're trying to make our evidence-based materials more accessible
Yeah.
So during COVID especially, we developed a lot of infographics and worksheets and different formats. So our clinician hub and our the clinician dashboard, our site generally has a lot of different resources for everything from what is anxiety to actual CBT-based coping tools that you could use in the moment if you were experiencing some distress.
Yeah, and we'll certainly put up the link as well with this podcast episode, so people can go and have a look at that a little bit more as well. Can you just talk us a little bit around, there's a whole range of programs and courses, some therapist supported, some not, some that practitioners can kind of use as an adjunct to their work with individuals. Who generally uses the This Way Up courses?
We find with our courses that our biggest clinician user base are GPs and psychologists. Specialists would probably be next in line, and then allied health and nursing, etc. And we really promote the blended approach. And we believe that the digital mental health tools can work really well with existing models of care to augment that care. So whether that's face-to-face or telehealth, to use the digital mental health tools alongside other treatments is definitely something that we advocate for. That said, we're all about choice, and you can access our programs in a self-guided or self-help manner.
Okay, yep.
So that there are options there,
Yep.
depending on what the person, the consumer would like, and depending on what's available to them. So we're, I think your question earlier was about, what does This Way Up aim to do? And I don't think I really addressed that, sorry, but I think, one of the big reasons that This Way Up was created was to address some of the barriers to accessing evidence-based care. And so, yeah, digital mental health treatments are so great, and they break down some of those barriers. There's no wait list. It's cost effective, it's evidence-based. And so, yeah, that we feel that can really help in the mix. To throw into the mix can be a really good thing.
Yeah, and I guess as well, it addresses that stigma that we know has been addressed, but it's still very much in existence. You mentioned before about having a range of different courses available. I think you said 18.
Mm-hmm.
Have you seen, well, I guess there's two questions here. One is sort of overall registrations as a result of the COVID pandemic. Have you seen a significant increase in usage? And also, are any specific courses more popular than others?
Yeah, really good question. We definitely saw a huge uptake in numbers, clinician and consumer registrations during COVID. And what's also interesting to us is that while that spike in registrations, we saw a spike, the number of people registering is sustained, and it's elevated above, say, 2019 figures, for instance. So that's really interesting that digital mental health has become more acceptable. And
why do you think that is? Sorry, Jay. Why do you think that is?
Well, I wonder if it's similar to what we're seeing with telehealth.
Telehealth, yeah.
And that, when you might be considering adopting a new practice, but when your face-to-face options are reduced, what are your other options? And so I think as well, we were able to offer our programs for free for a period of last year, which was definitely helpful. And we had that feedback both from clinicians and service users that was a really welcome option, I suppose. Yeah. And in terms of which programs, I think when I last saw the data, our mixed depression and anxiety was our most popular course, followed closely by managing insomnia.
Oh, that's interesting.
Yes, so they seem to be the most popular currently.
What are you finding, Jay, in terms of the numbers indicating that people are choosing to do this sort of self-directed, or are they going there sort of prescribed by their practitioner route, or I guess it's a mixture of both?
Well, I suppose we have seen an uptake in the clinician prescribed modality because we've been able to continue to offer that modality for free. So if we do encourage people to go to their health professional and have one of our courses prescribed or supervised, and they are able to access the service for free in that sense. And I think the feedback from clinicians is that they enjoy having that option to offer clients. So that seems to be working really well, and seems to have increased the number of clinician registrations, or the proportion of supervised courses as opposed to self-help.
Yeah, okay. Just out of interest, what would you say to clinicians who are, I mean, this is probably a better question for the end, but it sits well here. Clinicians who are thinking they know about This Way Up, they're thinking of prescribing it, but they're just a little bit cautious or a bit scared around, doing so.
Yeah, I call this digital mental health hesitancy.
Yes.
And it's completely understandable. It makes sense. And I think, the big message that we send clinicians is to try a course yourself, or to register on the site and have a look. Because if you're going to be recommending something to a client, it would be a good idea to have a look yourself and see what you think. Yeah. But we do find out from healthcare professionals that in doing so, they've also found the programs really helpful for themselves. Or for instance, we had a nurse contact us saying she'd been out looking for CPD, and she'd come across one of our modules and had completed it, and she was a mental health nurse who then realised that she also had undiagnosed anxiety and had been living with it for years, and found one of our programs, the generalised anxiety course, really helpful personally. And we hear from service users. We had somebody write in the other day and say that they enjoyed our introduction to insomnia program, and they've been recommended it by their GP. And the GP had been using the managing insomnia course themselves following some night shift, or in a period of their lives where they had been doing night shift. They found the course helpful. So we, that warm referral we find very, very helpful when the clinician has had an experience with the programs themselves. That seems to, help with the service users' hesitancy as well.
Yeah. I guess the practitioner has that level of confidence and knowledge of the detail of the program, I suppose, as much as anything.
Exactly. So our big message is try a course yourself. The other message would be that we're not suggesting that digital mental health treatments like This Way Up are to replace face-to-face or telehealth care, but they can blend really well, or work on discharge, or while you're on a waiting list, or there's just so many reasons that people can't access the care they need when they need it. So I think that's a good thing to keep in mind, that it's something to throw into the ecosystem. It doesn't replace any existing services and can augment. And the other thing I would say is we're developing a range of resources to try to support clinicians who are interested to start to use digital mental health treatments. And we're really trying to role model and demystify some of the conversations that you might want to have with your client around how to introduce digital mental health into your clinical practice.
I think that point that you just made is a really important one. We've had conversations with people before about this isn't a panacea. It's not a one size fits all. It's going to fix everything, but it's an additional tool in your toolkit, if you like, that people can use to enhance practice and access people. Yeah.
That's it. And I think it's really interesting to see around 50% of our service users are accessing This Way Up outside of office hours, and just the different ways that people report using it. We had a service user report that they had found themselves in a time of crisis and didn't feel able to speak to a psychologist, but commenced one of our courses and rang a phone helpline. And for 5 weeks, that was what got her through until the point where she felt that she could speak to a psychologist. So again, I think it's just another example of how digital mental health treatments can be used within the mental health landscape, and as an adjunct.
Yeah, it's just sort of picking up those people who maybe will just fall through for whatever reason, legit reason. I just wanted to ask you one question about sort of the people who the users, if you like. So we talked about the health practitioner perspective, and at eMHPrac we've done a lot of training with practitioners around how to use resources such as This Way Up. But what seems to be not so common is sort of training and supporting the consumers. We very much leave that up to the practitioners once they know what they're doing. What are your thoughts around that from the experience of This Way Up? Do consumers seem to, they're giving you good positive feedback, they're finding it, digital online resources easy to navigate? Any particular barriers been flagged for consumers?
There are so many barriers, I think, and in Australia, internet access is such a big issue, especially in rural and regional areas, unfortunately. But a lot of the focus of we've been developing some resources for consumers as well, and really focusing on that onboarding stage. So really taking people from that position of being interested to actually being registered. And sometimes they just need some support navigating through that process, whether that's registration support, creating a long enough password, these kinds of very practical things. And for clinicians as well, some people do need support. We all need support with these things at varying times, at different times. So I would say the technical and onboarding navigation side of things can be tricky for some service users, and we're trying to support our users through that process, and to try to make our offerings as easy to navigate as possible. I think is something we're very aware of. Also as inclusive as possible. And we're going to have in the next couple of weeks a bunch of a suite of resources for culturally and linguistically diverse communities. So not just information pamphlets, but also activity sheets, worksheets, actually used for clinical tools. So we're really excited about this because we know that, there's such a need. We hear from clinicians over and over again, there's such a need in this area.
So they'll be translated into a range of languages?
Yeah, we went with the top 10 most common languages other than English in New South Wales. So that should be, we're looking forward to launching that very soon.
Okay, we'll keep
very
an eye
proud
out
of that project.
That's fantastic. And just before we move on from sort of the specifics of the programme, generally I tend to ask most of the podcast conversation people this question, just because it's one that comes up for us time and time again about that relationship between the practitioner and the person using the programme. In all the training, it's really emphasised that therapeutic alliance or relationship, whatever you want to call it, it's really key. And people are concerned that gets lost with digital resources. What would you say, or what advice would you have to people who validly have those concerns?
Yeah, exactly. As you've articulated, they are valid concerns, and the therapeutic relationship is so important. And from our perspective at This Way Up, we're never going to replace that. What we're looking to do is to help with some of the heavy lifting that clinicians might be doing, to outsource some of the skills-based learning, and to also, offer service users the option to commence treatment stops, right away in their own homes if they want to. But we all know the importance of a therapeutic relationship, but that's not always accessible. And so what do you offer people when you've got workforce shortages, when you've got geographical barriers, cost barriers, wait lists of months and months and months, or the stigma of seeking help? And I think as well, just in terms of integrating digital mental health tools into routine care, you still are relying on that therapeutic relationship, whether it's telehealth or face-to-face sessions. And we really see This Way Up as being able to boost that. It can be a conversation starter. How did you go with module 2? Did you practice any of the skills? How have you applied those skills into your life this week? We only see it as adding value. That said, iCBT and digital tools are not going to be appropriate for every client. and not every clinician will want to adopt them into routine practice either.
Yeah.
But for
And
those
that's
who,
okay.
and that's okay,
Yeah.
exactly. And we're not expecting that either. I've spoken to a GP in a regional area, and he prescribes our courses, and the practice nurse where he works does phone follow-ups,
Oh, wow.
just to see, they're not therapeutic phone calls, just managing mental health as you would a physical chronic condition like diabetes, where the practice nurse calls and says, how are you going with your program? Have you registered? Have you had any issues? And they've, I think, been really able to support adherence, and have seen really good results. Again, for some of their clients, it wasn't appropriate and it didn't work for all. But for those who it did work for, it was really helpful. And in that area, they reported that their patients were having to travel 2 hours. They had an option to travel around 2 hours to see a psychologist in 3 different directions. So they were kind of in between 3 different centres, but they had no psychology services where they were. So that meant, that's a 2-hour drive plus a 1-hour session plus a 2-hour drive back. It's 5 hours to see a psychologist face to face. And for some of their clients, digital mental health was the only treatment needed. For others, they needed more. But I thought that was a really interesting example of how they've taken the digital tool and adapted it to their setting and have integrated it into care.
Yeah. And that fits in a little bit with what my next question was going to be, because, there's a lot of funding has been put into, especially recently, online resources, developing or keeping programs ongoing. There's a real sense of, we're trying to integrate this as much as possible into routine clinical care. And you wrote a couple of articles in Mental Health Nursing, I think, and one specifically on how these digital resources can fit. So can you maybe elaborate a little bit more on that, about how you see the role of broader resources in supporting those people at the front line in healthcare?
So the blogs that I wrote were for the Australian College of Nursing, and I suppose it was from my experience in the community mental health team, on the acute care team. And when we were doing, phone call follow-ups with some of our clients, we'd have people ask, well, is there anything I could be doing? It's Friday at 10 p.m. And we may have been planning to home visit that person or monitor them over the weekend, for instance, but people were asking for, well, what can I do myself? And I remember thinking, asking some of my more experienced colleagues, like, what can people be doing? And like there are phone helplines, which is obviously, very important. But yeah, now that I know more about digital mental health treatments, I look back on those experiences and wish that I'd been able to say to them, you could get started on an online program yourself if appropriate. I mean, some of the people in that setting obviously had very complex needs and severe mental illness. But interestingly, we had a paper published recently looking at whether or not iCBT could be helpful for people with personality vulnerabilities. And what we found was that iCBT was helpful to treat the comorbid anxiety and depression, and was not harmful for that cohort. And I found that really reassuring from my time in community mental health work. I would see a lot of people living with chronic high risk, where an inpatient admission is not necessarily the best option or available. And yet these people may not be getting the care they require in primary care, or, there's a lot of people suffering in the community, and I think digital mental health treatments are a potential offering for some people to consider. And I do acknowledge that it is not appropriate for everybody at every time in your life, and we don't, we're not a crisis service, obviously, and we're not a 24/7, we're not able to respond on a 24/7 basis, but our programs are available there online if a person wants to access them.
I guess I was going to follow from there as well and just say, for those people listening who think that a lot of the courses are, you just talked about not typically being for depression and anxiety, which I think sometimes people tend to think that there's a lot of the programs are out there for that. But again, some of the courses you have are, I think, PTSD or is there OCD? Can you just give us a quick?
Yeah, I can run you through a list. Okay, we've got the chronic pain, which was developed by the multidisciplinary team pain service at St Vincent's. We've got our post-traumatic stress, OCD, panic, health anxiety, social anxiety, generalized anxiety, depression in Mandarin language, depression, teen strong for 12 to 18-year-olds, momentum, pregnancy and postpartum, mindfulness-based CBT, mixed depression and anxiety, student wellbeing, introduction to mindfulness, managing insomnia, and coping with stress. And the only one that I would add to that is actually 19, is iCBT Foundations for Clinicians. And I would really urge anyone interested to learn a little bit more about iCBT and digital mental health treatments to register on our site for free as a clinician, and then undertake the iCBT Foundations course. Which gives you an introduction to the premise of CBT and how it can be helpful, and an idea of how our courses play out, the use of comic strips to normalise and to learn the skills of CBT. That's a really helpful course. We recently had that accredited at the Australian College of Rural and Remote Medicine. So that counts for 6 hours of PDP with ACRUfAD, which is great.
That was going to be my next question, actually, because that's great to have that. What kind of commitment for people who are thinking of enrolling? So it's around 6 hours of time.
Yeah, we say that each of the lessons take around an hour, and if you're accessing the courses as a form of treatment, it's all about applying the skills that you've learned in that session. So it actually is more, but in terms of the screen with the time on screen, it's around an hour per lesson with 6 lessons generally. Okay. So most of our courses are 6 lessons long. Chronic pain is 8 lessons. Our wellbeing courses are 4. So there's a little bit of variation depending on the course.
Okay. So we'll also put up obviously they'll be able to link through to the foundations of iCBT.
Yeah.
Via the This Way Up link, but we'll also put that, make sure that's up there as well.
Yeah, thank you. Okay.
I guess I'm getting mindful of time.
I'm fine for time. Something I haven't touched on was carers and families.
Yeah.
Yeah.
The role of these resources. Yeah, I think that would be great to just talk through the role.
Yeah, so I suppose in my time as in mental health nursing, I saw a lot of carers and families who were very distressed in their role caring and loving their loved one experiencing severe mental illness. And I see the utility of these digital mental health tools for those cohorts, for people who may struggle to leave the house, or whose schedule may be quite all over the place. And for also people who may not identify as having a mental health condition or may not have a diagnosis. Our coping with stress course, everybody could benefit from that course, I think, and it's still based on CBT. And we actually developed a carers resource, which is a brief PDF on our site, and it's really about supporting a family or carer, it's about the family and carers of somebody undertaking one of our courses as well, how best to support a loved one as they complete a digital mental health program, which is another interesting area, I think, and what, in terms of what to expect for families and carers.
So I think, because this is something that comes up often at some of the workshops and conferences that we do, is, providing resources for parents, siblings, etc. And yeah, there certainly seems to be a huge need in that space for that.
And I think you've just reminded me of something I feel really strongly about, and that's kind of that I see the potential for digital mental health treatments to be rolled out at a population level as a preventative measure, and for people to learn some of the psychoeducation and the skills way before ever presenting with in acute stress or in a crisis. I think it would be great if we could all learn these skills.
Absolutely. Yeah, I think you're absolutely right.
Early intervention, and yeah, I'd love to work out how to do that.
Yeah, I think that would go a long way to addressing what's currently happening,
Exactly.
looking at the trajectory of mental health and distress.
Exactly.
Just one question, and this is kind of a little, well, it's not off topic, but you mentioned you've got your well-being course and the coping with stress course. Do you think the language, because there is, as we know, still some stigma around, and people are like, I'm not depressed, I'm not anxious, but the language around well-being and it's maybe been stressed is not as perceived to be quite, for some people, as difficult to acknowledge as having symptoms of depression. Do you think that makes a difference in terms of the language of the courses and uptake, or not really?
I'm a bit obsessed about the language that we use, because I think my background is in communications, and I think it means so much, and it says so much, and it can be make or break for somebody's decision to engage in the content. And feedback that I've heard from other clinicians is that their clients will not click on something called depression and anxiety and don't identify as having them, don't identify with that diagnosis or accept it. And so I think it's, and this was really raised in the rural context, particularly with older males. And so that's definitely something that we are aware of as an organisation. And I guess there's that balance between we're a clinical research unit, and we have that standing with clinicians. People know CRUfAD, and we do have all these trans diagnostic courses, but as well we are trying to appeal to service users and consumers who may want to access our courses directly. So it's definitely something to consider. I think every word matters. Absolutely.
And I think that point you made about the language used is the make or break. They're either people are going to make the choice based on that, or they're not. So getting that right is so important and so difficult because of the range of people that are in our population, I guess.
That's it. Yeah. And I guess, it's just about providing choice and trying to reach people as best we can.
Absolutely. Yeah. I'm glad I asked that question now. That's very relevant.
It's a tricky one though, and it's it's hard to kind of resolve.
Absolutely.
I don't have the answer. I guess that's what I'd love to have, is the answer.
Future work or emerging work.
Yes, exactly.
So I guess just to sort of bring this conversation together, or to a close, we did touch on this a little bit before, but if somebody is listening to this, watching this and going, do you know, I think this actually might fit some of my clients really well, but there's hesitancy, whether that's because of, quality or safety, or, whether it's evidence-based, what tips or advice would you have for those people in terms of instilling some confidence to start using this way up, or other resources more generally?
It's a very good question. It's a very good question, and I guess the first step is just in understanding people's hesitancy in adopting digital mental health treatments. And for clinicians interested in looking at the evidence base, we have all our research published on our CRUfAD site. We've done over 30 randomized controlled trials, and iCBT is listed in the clinical practice guidelines for mood disorders and anxiety disorders as being as effective as face-to-face CBT. So, you know, that's a very good endorsement from my perspective.
Yeah.
We know that it can work, and we know that when a clinician supports their client through, you can see really good results in adherence and outcomes. So I don't know what the answer is in terms of overcoming that hesitancy for clinicians, but we're very much interested in continuing that conversation and supporting clinicians on that journey. You know, I think a lot of it is about workforce capacity building and support. It's about providing the tools that clinicians need and the technical tools, the exposure, the understanding, the role modeling. There's a lot of things that need to happen, I suppose. And also, we know clinicians are busy. When in their day do they, you know, if they're seeing patients, clients back to back, when do they get a chance to upskill and learn a new tool? We understand that it is difficult to adopt something new and to, you know, but I hope that on trying it, that people would realize that, you know, it's safe. You know, iCBT and digital mental health treatments like This Way Up are safe. Yeah. They're effective. Some clients will see great benefit from it, and it can augment your clinical care.
And there's safety mechanisms embedded in the courses as well for those who are concerned about risk, etc. Exactly. So I guess sort of really bringing it back, a really good starting point goes back to what you mentioned earlier on in this conversation around, you know, try the course yourself, give it a go. A lot of health professionals are starting to get a bit burnt out, they're tired, a bit stressed. Try one of the courses, and also the foundations of iCBT.
Yes, no, I completely agree. You know, try the introduction to mindfulness. I mean, what have you got to lose? Give it a shot. See what you think. Send me your feedback.
Actually, one question for that. Did you routinely get feedback from practitioners and consumers about the programs and the course?
Definitely, yes. And that's a big part of my role, is that stakeholder engagement and really understanding what's working for clinicians and what features they would like to see, or how they're using the services in their care. So we're actually just in the process of developing a new feature based on some feedback I got recently from a group of clinicians who had embedded This Way Up into their routine care and then came across a stumbling block. And based on that feedback, we're now developing a new feature. So we are very much able to listen to our clinicians and service users and understand that feedback and constantly improving the quality of the programs that we deliver. And like you were saying earlier, it's kind of, there's the programs themselves, but it's a lot about the resources and the onboarding and the support we provide people around those resources as well. So that's definitely something that we are looking at.
Yeah, along with many other things by the sounds of things. But it's action learning cycle, isn't it, of implementation, review, evaluation.
That's it. It's very, very agile.
Okay, well, that's probably the main sort of questions that I had for you. I don't know if there's anything else that we haven't covered that you wanted to.
No, I think we covered everything. I mean, we're in national service. I think I said that, did I? I hope so.
Yeah. So as I mentioned, we'll put up the website for anybody interested, and all the details are on there for both consumers and obviously practitioners who are interested in prescribing the This Way Up courses, or one of the suite of courses. Thank you so much, Jay, for
it's been lovely, Ruth. Thank you. No, I really enjoyed it. Yeah, I hope it's helpful and useful. So yeah, no, really appreciate the opportunity. Thank you.
Great. Thank you so much for joining us.